Video continues Chapter 18 of OEC 6 with Principles of Trauma, and specifically, we want to describe and demonstrate the management of a trauma patient. Now, a key term is the idea of the golden hour, and so we begin, as with all patients, with patient assessment. So in addition to a good patient history, we want to obtain trauma-specific information, such as looking carefully at the MLI. A thorough evaluation of what is injured is important, and if there are multiple traumas, we need a full hands-on head-to-toe assessment to find additional injuries. If the patient is critical, we want to take vital signs every 5 minutes to observe trends or changes in those vital signs. Now, management of this trauma patient is going to begin, as always, by correcting any life threats, or ABCDs, in primary assessment. Remember, that is to control excessive bleeding, and in the case of an unresponsive patient, maintain the airway. If we have a circulation issue, such as no breathing and no pulse, we'll immediately begin CPR. Spinal motion restriction may be indicated at this time too. Some multi-system trauma patients require a load and go approach. In this case, we consider the life threats, ABCDs, and rapidly load the patient into our toboggan and transport without delay. Now, oxygen can support this patient and the possible onset of shock, so we can administer that at 12 to 15 liters per minute by non-rebreather. However, do not wait for oxygen to arrive on scene. Complete the load and go and provide oxygen when available. The other part of treating for shock would be to keep the patient warm, because hypothermia can hasten its effects. For patients who are stable and do not require load and go, we can then focus on less critical problems, such as stabilizing a long bone fracture by splinting and preparing the patient for transport. Patients who require spinal motion restriction should be secured to a long backboard or in a basket-style litter, and then additional treatment decisions depend on reassessment findings. Now, all of this is against the backdrop of what we know to be the golden hour, a crucial period during which survival rates may be improved for patients. In backcountry settings, immediate evacuation to definitive care is essential. Remember, critical multi-system trauma patients may require load and go. Manage the ABCDs, our life threats, and transport without delay.